First and foremost, let me say thanks for inviting me. There's really never been a better time to be a hypertrophic cardiomyopathy patient or a hypertrophic cardiomyopathy provider. And these guidelines, they update a state of the art from just a few years ago, the changes. And there are several. I think today we're going to focus on just the medical management of obstructive hypertrophic cardiomyopathy. And the way we think about hypertrophic cardiomyopathy is that it is the most common genetic heart disease. It affects 1 in 500 people. We do a less than outstanding job of making the diagnosis, so we have to do a better job of identifying it. But once we find it, we break them up into those that are obstructive and those that are non-obstructive. And obstructive means that the blood flow leaving the heart is limited by a valve that gets in the way as it contacts the muscle and prevents the blood from leaving the heart. This new FDA-approved drug is now part of the medical regimen for that. Traditionally, we would use medicines like beta blockers and calcium channel blockers to try and lower the heart rate. That allows for more filling of the pumping chamber, and then more blood can then exit the heart. It's not specific for hypertrophic cardiomyopathy, as it is not only utilized to manage those with obstructive hypertrophic cardiomyopathy. The new drug is the first, and right now the only FDA-approved cardiac myosin inhibitor, which is a new class of drug. And it's specific for hypertrophic cardiomyopathy patients. So it targets the mechanism of hypertrophic cardiomyopathy and obstruction. And what it does specifically is that it acts on the actin and myosin chains that are inside the heart muscle. And in hypertrophic cardiomyopathy, there are too many connections. And the way I think about this is that if you think about how a rower a rowing team may look, where there's a whole bunch of rowers in a boat, and when they lean forward and they pull back, that propels the boat forward. And in hypertrophic cardiomyopathy, there's too many rowers. So what this drug does is that it tells many of those rowers, don't row. And in doing so, it brings it down to the number of rowers inside a heart muscle that is in the non-hypertrophic cardiomyopathy patient. And by doing that, the pumping function goes down a little bit. The gradient, which is the pressure difference between the inside of the heart and the outside of the heart, goes down, and the symptoms go down with it. And what's most important is that patients feel better. So if you're a cardiologist who is taking care of patients with hypertrophic cardiomyopathy, first and foremost, you're going to do the things you've always done, which is remove the medicines that worsen obstruction, like diuretics and blood pressure medicines. And then these should be folks that are on treatment with beta blockers and calcium channel blockers. And then think about myosin inhibitors as being added on to that therapy to then further reduce the obstruction and hopefully make patients feel better. It's a drug you add on top of it, on top of standard therapy. And what you should know as a cardiologist and as a patient is that there's some surveillance that must be done while you're on the therapy. So the biggest side effect we worry about with mavacamten is that it can lower the ejection fraction, lowers the pumping chamber of the heart. So as a result of that, we then use echo at 1 month, 2 months, and 3 months to make sure that that's not happening. And then we follow them every 3 months after that. And during that time period, while we're watching to see the ejection fraction hopefully stay the same, we're going to adjust the medicines up and down to try and make the patients feel as well as we can by optimizing the medical therapy they're on. So I think the key takeaway is that if you're a patient and you have symptomatic obstructive HCM, if you're a cardiologist taking care of HCM patients with obstruction, this is a game-changing, first-in-class medical therapy. We now have about 2 years worth of real-world data suggesting that what we saw in the studies is what we're seeing in real life, that patients feel better, they're improved on this, and this is a opportunity to try and treat more patients with hypertrophic cardiomyopathy and symptoms from obstruction than we've ever had before. If you're not familiar with it, reach out to a center of excellence and see if we can initiate the therapy and then do this collaboratively over time. This is an important game-changing therapy for patients.